At 6 weeks after surgery, you should be thinking of your knee replacement as about halfway better. It should be a lot better than it was at the first post-operative visit, but it's still swollen, still warm, still irritable. You still feel that clicking from time to time. You're still numb on the outside of the incision. You're probably helping yourself out of a chair with your arms. You can do stairs, but it's difficult. You're probably doing one step at a time. About half the folks are off their pain medications, and the other half are still taking some. If you're still taking some, probably not taking it every so many hours anymore, hopefully, but just when you need it. And usually the last pain pills that people are willing to give up are the ones at night. So that's the typical picture at 6 weeks. It's very common to feel tired. Fatigue is very common after a big surgery. It's common for people to tell me that when they wake up, they'll take a shower and eat their breakfast, and by the time they've done that, they're ready to lay back down again. And very, very normal after big surgery. A lot of your internal reserves have been spent to heal you up, and you'll gradually regain that vigor. But that's a normal situation. It's still not time to do much strengthening. Some people recover a little bit faster than others, but don't be in a hurry to be vigorous in strengthening. If you just tune into what your knee is telling you, you won't do too much. If you're not certain if you're ready to do this or that, you can do a little bit of whatever it is. I'm fine if you get on a stationary bike or if you go to a gym and do a little bit on your own. If you get into the water, I just don't want to turn a formal therapist loose on you just yet. So you can adjust your activities according to what your knee tells you, but overactivity is one of your biggest, most common mistakes. But if your knee doesn't mind whatever you're doing, then I don't mind. So if you're having a lot of aching at night or stiffness and swelling, no matter how minimal your activity, it's not minimal enough. Activity and swelling go hand in hand with pain. So the less you do, the less you'll hurt. People sometimes ask me about returning to work. Before surgery, I would have probably told you to expect about a 3-month interval before you would return to work. But in honesty, it does depend on the job, of course. Depends on the person and the kind of job they do. And if you have a part-time job or a job where you're not terribly physically active, you might begin to feel like you're ready to return to work or return to work part-time. Talk with me about that. If you tell me you're ready to go back, I won't say no. But again, there's no reason to hurt yourself. If you have a more demanding job, heavy manual labor job, sometimes even 3 months isn't enough time before you're ready to go back to work. So we'll work on that with you person by person. But don't be in a hurry. Your range of motion by now should be decent. You should be keeping the knee straight. You should be flexing well past 90 degrees. The motion you get with difficulty now, you'll get with ease and time. If you're worried about your range of motion not being sufficient, please talk to me. Lastly, there will be a time for strengthening, for a formal strengthening program. I usually do that between 8 and 12 weeks after surgery, depending on the person, and some people by then don't feel like they need it, and actually that's relatively common. But we do know that knee replacement surgeries, that the happiest patients have the strongest legs. So if you look at a large group of total knee replacement patients, the vast majority are happy, but of those happy patients, some are very happy and some are happy but, and the happiest patients tend to consistently have stronger legs. So that information long ago got me started on a phase 2 of the therapy, which is a strengthening program, which we'll do 8 to 12 weeks later. Some people just do it on their own. They'll just go to a gym and work on the leg machines, and all those leg machines are fine where you sit and push, or your hamstring curls, the knee extensions, all that stuff is fine. Simply a bike or simply walking is good for motion and it's good for lots of things, but the strength we're talking about really requires weightlifting, whether it be squats or machine strengthening. It's squats, squatting way down, like to sit on a chair, for example, and stand back up again. That's the strength that we're looking for. That's what will help you go up and down stairs foot over foot as would be natural. Again, between 8 and 12 weeks, either at this visit we'll talk about phase 2 therapy or at the next, depending on the person. Some folks who maybe have a large copay and don't want to go to therapy because it's going to cost them a lot, or don't have access to therapy for one reason or another, the fundamental exercise is squats. I ask people to pick a kitchen chair and sit in front of the table, scoot your buttocks way to the very edge or the lip of the chair. Use your fingertips on the table just for balance, and then stand. Okay, and then squat down until your bottom just touches the seat and try to stand again without sitting. Now, many of you can do that, and many of you can't at this point. If you can do that, great. Do that once a day, as many times as you can, until your legs are tired enough that you either have to cheat more by pushing with your hands or you end up just sitting down. The chair has two purposes. It's to catch you on the last one, because I really want you to go to fatigue. The muscles respond and get stronger when you really fatigue them. And it's also a goal. You can do shallow squats with many of them, and they'll do no good for you. You need to go deep enough to cause the muscles to work. So you want to go all the way to your bottom, touches the chair, and stand, and do that repeatedly until you can't do any more. If you can't even do one, which sometimes happens, I would encourage you to go slower yourself down to sitting, and then just go ahead and sit, but then stand right up again, and do that repeatedly until you're pooped. I encourage you to put a check mark on the calendar. Today I did 1 or 6 or whatever number you did. And the next day say, okay, I did 3 or 4 yesterday. Well, today I'm going to try to do 1 more than the day before. And as you go along, those numbers should increase. If they make you terribly sore to do that, and all day long and that night you're really sore, then we're pushing a little bit too soon. If you have some soreness while you're doing it, but 2 hours later you're no worse for wear, then that was okay. So in time you should be able to do that 30, 40, 50 times. If you get to that good, which is great, then maybe move to a lower goal, like the commode or a lower stool. And again, trying to get up and down without your hands. That's the kind of strength. It takes a while to build. I would encourage you to plan on doing that for 3 or 4 months. But as you improve, then you'll find stairs coming along for you and uneven ground coming along better, and you'll like your legs better. Don't forget the hotline phone number. Any questions, any problems, 24 hours a day, call that number and they'll get a hold of me. At the 3-month visit after surgery, your knee's about 75% of the way better. Most people at this point will tell me, I'm doing pretty good, but. There's still a but. You still nudge yourself out of a chair, maybe with your arms a little bit. You still get achy at night. Maybe you don't feel real confident on uneven ground or going downstairs. Descending stairs, foot over foot, is usually the last thing to come. Again, we talked about strength last time, and strengthening is the way to improve your leg function from here forward. People often ask me about kneeling. You're allowed to kneel on a total knee. Previous years, I believe on an earlier DVD from years ago, I said only about 10% of my patients get back to kneeling. At this stage, with current techniques, most of the people who want to get back to kneeling can. It usually takes several months before you're doing that, though. It may be 6, 9, 12 months before you're most comfortable kneeling. If it's important to you to kneel, generally you can get back to that. It won't do any harm to the total knee, but there's naturally a cushion in and around where the surgery was, which has now been operated through. So it's a little scarred and a little less effective as a cushion. And so you're allowed to kneel. If you wish to kneel, I encourage you to kneel on a big thick pad like the couch or a couch, a pillow, that sort of thing. If you'd like to get your knee used to kneeling after several months, I wouldn't even start for several months, but after 6 or 9 months, begin the kneeling on the couch or on your bed and kind of desensitize those tissues. And eventually kneeling will come. It's also important to talk about limitations. Now, total knees are made to use. People farm on them, so they lift, they climb, they kneel, they hike. There's no lifting restrictions. I've had people get back to heavy kind of bodybuilding, weightlifting sorts of things. That is all okay as long as comfort permits. But there are, I think, some limitations to artificial knees. Some surgeons don't put any restrictions on their patients, and it's not that their techniques or implants are particularly different, but it's just a matter of how much risk seems appropriate. It seems to me that jumping, pivoting, twisting, turning sports are too much on an artificial knee. Racquetball, tennis, basketball, things where you would jump, plant, pivot, twist. Those are sharp forces, brisk forces on an implant, and the stresses can spike very rapidly. Those are where situations could result in problems. So I would recommend against those kinds of activities. But otherwise, cycling, hiking, walking, weightlifting, swimming, they're made to use. So enjoy them. If you have trouble, let me know. You're going to get better and better for about a year. I'd like to see you at the first 1 year anniversary, thereabouts, for a 1 year x-ray. And assuming all's well at that point, every other year we'll send you a card in the mail and encourage you to come back for an x-ray. That's just to keep an eye on things. If you have a problem down the line, of course you call me and we'll be happy to see you and evaluate you. But even if all's well, every other year to get an x-ray seems to be a good idea. There are some occasional smaller things that might show up on an x-ray that you wouldn't feel, and it would be wise for us to pick up those things early as opposed to later. But otherwise, use it, enjoy it, and I hope your surgical experience was all you hoped it would be. A few other things come up, like airports and metal detectors. We used to give cards to patients to go through metal detectors. We don't do that anymore because they can be forged, and therefore they're really not valuable, and the metal detector people know that. So they won't want to see a card. So what I recommend you do now is when you come up to a metal detector, assume that you'll set it off. You can even tell them, I have a total knee or two total knees, and I'm likely to set this off, and they'll just say, okay, walk through, and you'll set it off, and then they'll pull you aside, and they'll wand your knee. Just relax and be respectful, let them do their job. Realize that they see a whole lot more total knees than terrorists, and you should be fine. Just maybe give yourself a little extra time, and again, be very respectful to those people, and it'll make your life easier. So again, I want to have you call me if you have trouble. Otherwise, we'll see you at the first 1 year visit.